Hello and welcome to another case study on debilitating pain. What would you do if you had 18 months of pain, you spent $6,000 on massage, therapy, chiropractic, you were seeing a neurosurgeon, but you were getting worse. So I have James, who graciously agreed to do the case study because he's in recovery. He doesn't have the pain, the debilitating pain that he suffered. I'm Tascade, and I help people overcome debilitating life-inhibiting conditions. Hey James, how are you doing today?
I'm good, thank you, Ted.
Fantastic. So let's get into this very practical, meaty story of yours. What were you like before we started working together?
I had chronic inflammation all through my upper back and neck and shoulder, which was going on for about a year and a half.
And did it restrict you? Can you do things? Could you work? Did you have to change
I
careers?
I had to change careers. That was one thing. And then I was pretty much going to work during the day. And for the most part of the year, I was coming home and lying down on the couch.
Hmm. But what did you think you needed? Like when you were seeing the neurosurgeon and he showed you that you had the stenosis and you had the osteoarthritis on the x-rays and that surgery was the only option, what did you think?
I guess I didn't want to have an operation. I didn't feel that that was the best course of action to get rid of my pain. Even though I had tried massage and chiropractor and physio for almost a year. I got referred to you and thought I'd try something different.
Yes, you're open-minded and it worked out.
And it worked out good, yeah.
Yes. So we've been working for 3.5 months. And how are you now? What three benefits have you gained as a result of us working together?
A massive one is just less anxiety about my pain. Um, I'm sleeping way better, and I'm in less pain in general.
How would
Um,
you rate the pain? How would you, what is it typically on a day-to-day basis?
it used to be about a 7 out of 10 on average, I would say, most of last year, and since I started seeing you, it's probably got down to about a 2.
And these days, what would you,
Between a 2 and not much at all. Yeah.
amazing.
Um, I'm also just not thinking constantly about my pain, and I can just get along with my life much more than I did before.
So I do remember you were really concerned about surgery. It was like the hidden subtext that is going to be the only thing that is going to fix the stenosis. And what was the shift? What helped you to put that behind you and to focus on solutions?
Um, I guess being referred to you and being open-minded for something different, and just a lot of things that I've learned of you in regards to pain, and that your body can change and heal, which I suppose before I started talking to you, I didn't believe. I thought
Yeah.
that this is my situation and my pain is going to get worse from here.
Yeah, a lot of people with that physical pain give up believing that they could heal this, that pain's in the brain. There's a lot of anger and frustration, and yeah, I could see why people do have surgery because it's being promoted as the only solution. So you're not heading down that road. You don't need surgery.
Definitely not.
What a relief. So, what was the aha moment? What was the turning point? And at which point did you realize that you are getting better?
I think actually quite early when we first did our first tapping session. I remember at the time when we did it, I was thinking in my head, I'm like, what is this actually achieving? And then in the coming days after it, I remember anytime I had like horrible thoughts about my pain, I just wasn't entertaining it in my head in the same way. And how that just doing that reduced the actual pain I was in, like significantly, I think by like at least sort of 40%, 50% at the time.
Yes. And we did your hormonal analysis, which showed why you had the pain. It was consistent, congruent, and that motivated you to make changes with your nutrition and to take some subs to rebuild and to break up the stenosis, because the body rebuilds itself every 12 months, as you now know, but you need the raw materials
That's the one.
to do that. Yes. So how did you find the nutritional side of the...
Yeah, really great. Really great. That's definitely made a difference as well.
What kind of difference?
Yeah, I think maybe from our initial sessions, it's just that my pain's been reduced so much. I think the sleep as well.
Yeah.
I think from changing and having supplements has definitely had an effect on the sleep. I was like usually waking up sometimes 2 or 3 times a night. I can sleep.
Yeah, I remember you said you're waking up around about 3 a.m. The magic 3 a.m. for some reason that a lot of people wake up.
Yeah.
Yes.
Racing heart, palpitations, fun stuff.
And this doesn't happen anymore, right?
It doesn't happen anymore.
So you're sleeping soundly and beautifully. That's good to hear. It definitely helps. And so the inflammation, the key was to tone down the inflammation from every angle, with the sleep, with nutrition, with the subs, and of course with the EFT tapping sessions.
Yeah.
So now you know the formula for healing. It's never going to be one thing. It's not going to be physiotherapy or nutrition or even just EFT sessions on its own. It's a combination of 3 things in your case that implemented at the right time.
Definitely is.
Yes. So what would you say to people who've got mysterious pain one side of the body and they're having steroidal injections? And I think you've had them as well. And they're thinking of, if they can just continue with the steroidal injections for 6 weeks, they can do the time. What would you say to these people, and what is their outcome? What's waiting for them?
There's definitely a different way. Yeah, I think just knowing that your body can heal itself by doing the things that you've told me to do. So, yeah, I don't know. I definitely recommend giving it a go.
Yes, what have they got to lose? But when you can spend on the average, $6,000 on physical manual, therapy, and that's just the massage, the chiropractic, the physio, without even surgery or recovery. So pain teaches us a lesson. Pain changes us inside out. So who is James today? How are you different today?
I feel I'm pretty much back to my old self mentally. Yeah, physically, like I know that it's like an ongoing process because I did do a hard physical labor job for 20 years. So I know that that's going to slowly get better over time, but I'm confident that it will. Whereas before I was not, before meeting you.
Yes. And you are still active and you are still working. So it's not like you had to completely rest and not do anything.
Yeah, it's true.
Excellent. So moving forward,
moving forward, I don't know, I just feel more optimism about life in general, and just looking forward to achieving goals that I have. So it's great.
Awesome. Well, thank you for sharing your story. And I know you're a private person, so this was a big ask.
That's okay, no worries at all. You helped me greatly, so happy to.
Awesome. Okay, thank you.